welcome. You're watching The Big Story. I'm Afrida Ali. We are addressing a rather important issue of the COVID vaccine today, looking at it from the perspective of its possible adverse effects. And this has now become relevant after a statement made by the Union Health Secretary. While the country gears up for the COVID vaccination drive soon, the centre has alerted states regarding the possible adverse effects of COVID immunization, citing that adverse effects have been reported from countries like UK, where the vaccination has begun. Health Secretary Rajesh Bhushan says that states must indeed prepare for it. First, let's listen in to what the Health Secretary had to say on this.
एडवर्स इवेंट्स फॉलोइंग इम्यूनाइजेशन, ये एक क्रिटिकल बिंदु है। जब हम यूनिवर्सल इम्यूनाइजेशन प्रोग्राम करते हैं, जो हम अनेक दशकों से इस देश में करते आ रहे हैं, तो भी बच्चों में और गर्भवती माताओं में कुछ प्रतिकूल प्रभाव दिखाई देते हैं टीकाकरण के बाद। तो इसलिए जब भी हम कोविड-19 का वैक्सीनेशन प्रारंभ करेंगे, तो उस समय भी एडवर्स इवेंट्स की संभावनाओं से इनकार नहीं किया जा सकता है। जिन देशों में इम्यूनाइजेशन प्रारंभ हुआ है, विशेषकर यूके, वहाँ पहले ही दिन एडवर्स इवेंट्स हुए हैं। तो इसलिए ये आवश्यक है कि राज्य सरकारें और संघ शासित क्षेत्र इसके लिए भी तैयारी करें।
All right, joining me here on Mir Now today is Dr. Om Shrivastav, Director of Infectious Disease from Jaslok Hospital and Research Centre. Very good afternoon, Dr. Shrivastav. I appreciate your joining us here on Mir Now for this conversation. This is an important discussion that we must have, because now we are at a juncture where we are talking about what is the price to pay, not just in terms of the monetary value, but in terms of the adverse effects if an individual chooses to or is made to take the COVID-19 vaccine. First, there was a clamor for the vaccine. Now there are doubts and fears as well in the minds of the people, especially when statements like this come from the centre, that there is a possibility, and especially when other countries report such instances of adverse effects. I want you to explain to our viewers, Dr. Shrivastav, that how does a vaccine actually work in a human body, and what are the chances that it may fail in its intended purpose? What could be the collateral damage that an individual may have to go through?
So if you look at the process that involves the vaccine production of all of the vaccines that are being spoken about at this time, some of them are brand new, like the messenger RNA vaccines. That process has never been attempted in the past. So it is in fact a pretty exciting kind of a process, because the evidence so far appears that it appears to be working, although we will know only after it is actually being used on human beings as to how much it is working, and that process will take another 6 months or 1 year or maybe even longer than that. There are those other vaccines which are vector-based vaccines, and they have been tried in the past, but do remember that this is again a brand new condition. The COVID-19 we have known for less than 9 months, 10 months, somewhere there. Also remember that in the last 10 years' time, the vaccines that we have, if you were to look at the last 2 vaccines in the last 10 years' time, the rotavirus vaccine took about 15 years to be approved, or the entire process to be ratified and approved. If you look at the Ebola virus vaccine, that took about 5 years to be ratified and approved. So if you're going to say that, yes, we have looked at the entire process for the COVID-19 virus vaccine in 9 months or 10 months, you are bound to have compressed some of the steps and gotten some of the approvals. Where are you likely to have missed some steps? Are you likely to have missed something? That is something we will need to keep in our mind as to whether or not this kind of a compressed process may actually throw up some surprise. I'm sure you're familiar with the Queensland vaccine. You know, they had to junk it in large numbers because there was a series of false positives for HIV in people who were receiving the vaccine. So those kind of things are part of a process that we don't know enough about, and therefore, yes, some kind of unpleasant surprises we are likely to hear about or see, but we need to be mentally prepared for that. I agree that the process of the vaccine in itself is very exciting, and I'm hoping that it works for the greater good. But I think that in the process of approving these vaccines at short notice, there may be some steps that may have been missed.
Yes. That's a very important point, Dr. Shrivastav. And like you said, I mean, within a period of 9 to 10 months, if a vaccine has been developed, were some compromises made? Now, that is a very important question. Will we ever know the full transcript of this? If there were compromises, what were the level and extent of those compromises, and how will those compromises manifest as? Because when we are already saying that, yes, there can be some adverse effects, is there a policy now for governments across the globe to actually somehow do this for the greater common good? There is an emergency, there is an urgency, and therefore compromising a few steps perhaps is a smaller price to pay in the overall scenario?
But there again, look, if you are going to say that, look, some adverse events may occur. If you see in the past, the adverse events of vaccines, they've not been major adverse events. You know, you find maybe an isolated incident.
Back, I'm in conversation with Dr. Om Srivastav, who's the director of the Infectious Disease Department in Jaslok Hospital in Mumbai. Dr. Srivastav, you were talking about how some steps may have been compressed in developing the COVID vaccine, since there was such a sort of an emergency to come up with something. This has become a global public health emergency. But I want to understand from you, what would be your advice to people who are skeptical at the moment about taking the vaccine, given the fact that some side effects and adverse effects are being spoken about? If I can just bring to your notice here, in terms of Covishield and Covaxin, already certain anomalies have appeared. And there isn't a full disclosure. It seems there's a lack of data provided by these two Indian vaccines. And therefore, that has raised to even more a sense of uncertainty. Whether there will be a full disclosure to people, will we know the full transcript, what we are in for when we take these vaccines?
Well, that remains to be seen as to, the entire amount of data will be made available. It should be. It's only fair that people who are going to be taking that vaccine or people who are going to be recommending that vaccine should be having all that information in the public domain. Only then it can be made a full recommendation. That may or may not happen for a number of reasons. I'm not going to go into that. But you see, a number of the side effects that you're talking about are things which may be trivial or minor, or it may be major. Please recollect that in the most recent past, the dengue vaccine that was being trialed in a Southeast Asian country, the vaccine actually was vector based, and that when it got to the system of the people who were volunteers for the vaccine, it changed in such a way that there were about 200 deaths, and that is how the vaccine got junked. So vaccines are not simply a matter of loading something from the virus onto a vector and then pushing it into the human being and that hoping that nothing is going to happen. Some things will happen. They are proteins. They are going to be following a certain pathway, and those pathways of those proteins may change, may not change. You will never know until you actually start injecting that. So all the information that has been put into the manufacturing of the vaccine should be made public. It is only fair for the person who's taking the vaccine that he or she should be made aware.
Absolutely.
Side effects are often trivial, small. If you look at the side effects of other vaccines before COVID-19 vaccine, they have not been such that, humongously harmful side effects, but they should be put in the information of the people who are taking the vaccine. And that it should be scrutinized.
Absolutely. And that leads me to my other question as well. Yes, Dr. Srivastav, if you can also help us understand that, okay, even if we assume for a moment that you do not get any of the side effects, would it still be foolproof, in the sense, can a COVID-19 vaccine insulate me completely from contracting the infection? What could be the margin of error there?
Again, if you look at the total number of variations of the COVID-19 virus from the first time it has been described, between then and now, there are about 1600 or 1700 whole genome type mutations. That's the number of mutations that are already present there. What that means is that the virus, as we know, when it started off, in December of 2019, to the virus as we know in 2020, has that many variations. There are some small variations, there are some big variations, and you don't need to be a scientist to see that the virus as it was in say February and March of this year in other parts of India, and the virus in a place like Delhi. In Delhi, it was far more aggressive in just the recent past, just the last month and a half, 2 months. And that is how you know that the virus is changing. It is not going to be sitting still. It's not going to be static and waiting for something to be attacking it. That is the nature of the virus. It's a small virus, it's an RNA virus. It will keep changing to protect itself. And that when it is doing that, it is going to make the vaccine or any therapy not just ineffective, but also potentially redundant. It will try and make that either ineffective or redundant. And that's the protective mechanism of the virus. So, will the vaccine be completely effective in everybody all over the world? It's very difficult to answer. I think not. I don't think that's going to happen.
Very difficult to predict that. I understand. Yes. There are those uncertainties, and therefore there are as many questions as there are answers probably even now. The UK government has said that those with significant history of allergies should not take the vaccine. Will a similar directive come here as well? We'll have to wait and see. But clearly, like Dr. Shrivastav also said, there is a lot in the territory of the unknown. We have to go along in a trial and error sort of a method for now. Thanks very much, Dr. Om Srivastav, for joining us with your views on the subject. Let's take a short break now. On Mirror Now, news and updates continue on the other side. Stay with us.